Welcome back. Hearing is something many of us take for granted, but untreated hearing loss can cause problems at work, at home, and with your social life. Hearing aids don't have to be complicated or embarrassing. The latest hearing aids are available from experienced audiologists at Advanced Audiology. Dr. Barbara Jenkins is here today to show us the latest in hearing aids. Thank you for being here.
Thank you very much, Chris.
Now, like we do with every company that we have on Haystack TV and that we have on haystackcolorado.com, we do background checks. So I'm going to tell our viewers what we found out about you and your company.
Okay.
We found out that you are Colorado's first board-certified doctor of audiology. You have more than 25 years of both hospital and clinical audiology experience, and you serve as an audiologist on the Colorado Commission for the Deaf and Hard of Hearing. So all very impressive resume. It's great.
Thank you.
Let's get into now what you do and talk about hearing loss. How common is hearing loss?
Chris, hearing loss is actually very common in the United States today. 1 in 4 families is affected by hearing loss. And the problem is untreated hearing loss. A mild hearing loss left untreated can adversely affect your brain's ability to interpret speech later on when you do decide to get a hearing aid. What happens is, just like with the rest of your body, you have a use it or lose it effect. So if you have a hearing loss and your brain's not getting the stimulation it needs, some of the neurons that interpret that speech will slowly weaken and actually die off. And actually up to 25% of those neurons can die off after more than 5 years. So what happens is later on when you go to get a hearing aid, you put a hearing aid on and you are not as capable of hearing and understanding speech as if you had gotten a hearing aid earlier.
So it's important to get this early on. Don't wait. And don't be embarrassed.
Definitely. Not getting a hearing aid today can make it so that when you do get a hearing aid later on, it doesn't work as well.
All right. Well, we have a testimonial from one of your patients, Rick. Let's go to see what he has to say.
Okay.
Hearing loss was just aggravating. It was embarrassing and aggravating. I just kept repeating everything I said, and I couldn't understand why people wouldn't talk louder, why everyone mumbled. Those around me that cared about me said they would stop caring about me if I didn't do something about my ears. A world of difference. I really can understand what they say. I could be in a different room and I understand. And TV gets to be a lot lower now. That's huge. No one will know you're wearing hearing aids unless you want them to, which is a big issue for me.
You know, it really is amazing in looking at that photo or the video, you really cannot see those hearing aids.
Right.
In fact, I'm wearing one.
You are wearing one today.
Yeah, so
actually, the one you're wearing too is very common. See, why don't you go ahead and take it out, and I want to tell you something about that hearing aid you're wearing. That hearing aid has more processing speed than your home computer.
It's unbelievable.
It is. Hearing aids today, the main reason people don't wear hearing aids are because of cosmetics, which really isn't an issue. Sound quality, and then the cost, and none of those are an issue today. The one you have is a high-end computer. Hearing aids today have Bose noise canceling systems, speech enhancement algorithms to them, a lot of different things to help you hear better. The sound quality is unsurpassed. And as far as cosmetics goes, that shows how little they've become, and actually there's another one out called Lyric 2 that is so small you don't see it at all. It is tiny. It's built, we implant it into your ear. It stays there for 3 months. You don't take it out. You don't change the battery. You can shower with it. You can do whatever you want. And then in 3 months, you come back to the office and we change it for another one with the battery. So cosmetics are not an issue anymore. And if you have a severe hearing loss, I have one here. This hearing aid, I don't know if you can see it, this tiny one is for severe hearing loss. And it has 2 processors in it. It is a strong computer. So there's really no reason not to get a hearing aid anymore. The cosmetics and the quality are unsurpassed.
Yeah, that is really amazing. We have another testimonial. Let's see what Mike has to say.
Okay.
My wife, the kids having to repeat themselves and elevating whatever it is that we're telling you initially. And then the jokes start kind of, probably need your hearing checked. Meetings became a little bit more difficult, having to rely, you found yourself relying more on others, the body language, reading lips. You miss out on a lot. Nothing to fear. Nothing to fear at all, and hearing aids are not what they used to be 15 to 20 years ago, or even 5 years ago, frankly.
And what is the primary message that you would like our viewers to hear from you today?
Really, Chris, it's okay to have a hearing loss. Many people do, but it's not okay not to treat that hearing loss because it will adversely affect you in the future. So, you know, cost used to be an issue. Just recently, the manufacturers have lowered the cost on hearing aids so that even the high-end ones are more affordable now, so there's no reason not to get them. And in our office, in fact, you can test drive a hearing aid before you purchase it. So if you come in and you qualify, you can take a hearing aid just like the one you had in your ear, try it for a week, see if you do notice an improvement so that you're not pressured, so that you feel comfortable with going ahead and protecting your ears and getting them taken care of.
All great information. Thank you so much for being here. I'm going to let people know how they can get a hold of you. If you suspect you have hearing loss or are over the age of 40, you should get your hearing tested. Dr. Barbara Jenkins at Advanced Audiology has 25 years experience. Call her at 303-649-2122 and visit the website advancedaudiology.info to learn more. Saturday appointments are available. The number once again is 303-649-2122. Dr. Barbara Jenkins paid for this segment.